the Neurodivergent Lived Experience panel. So it's going to be chaired by the lovely Adele, who's also the chair of the Neurodiverse Staff Network. And these guys are from across the university and will be talking about what's helped with working, studying and thriving here, and what managers, supervisors and colleagues should really understand about reducing barriers. Over to you.
Thank you, Sharon. So as Shell said, I'm the chair of the Neurodivergent Staff Support Group. So if you are neurodivergent and not a member, please let me know and I will add you if you would like to be added. Right, so I'm going to ask this first question to all of the panel. So just introduce yourselves. What is your role here at the university, your neurotype / multiple neurotypes, and when you got diagnosed? So I'll start with my lovely colleague, Jenny.
Hello, can everyone hear me okay? Well, fantastic. So my name's Jenny. I'm a disability advisor, so I work in Central Professional Services in student life. I have a diagnosis of dyslexia, dyspraxia, ADHD and autism. They were diagnosed in that order. So I was actually diagnosed with dyslexia by accident. My neighbour was training to be a dyslexia assessor and was practicing a post-16 diagnostic assessment on me, and then surprise, I have dyslexia. And that kind of opened the door really, especially, you know, within our family, neurodiversity wasn't really spoken about a lot, and so that kind of opened some more avenues for support. I started to engage with more disability support when I was at university, and then I got further diagnoses from there, and I'm really happy in my day job to be supporting students so that they can thrive at the university.
Hi, I'm Sophie Lewis and I'm an undergraduate student studying environmental science at the University of Liverpool. I am autistic and I have Erlins, and I was diagnosed at 18 just as I was completing my A-levels. I absolutely love being at this uni. It's so supportive. So, yeah.
Thanks. My name is Lance Turtle. I am a professor in the Department of Clinical Infection, Microbiology and Immunology, and I'm a consultant physician in infectious diseases at the Royal Liverpool Hospital. I have Tourette syndrome. I don't know that I've ever been formally diagnosed. I certainly fit the diagnostic criteria for Tourette syndrome, and when I was in my mid-20s, and I was at medical school, I was in a lecture by someone called Professor Mary Robertson, who has since retired, but as anyone with Tourette's knows, she was the sort of godmother of Tourette's research in the UK, and she was giving this lecture about the diagnostic criteria for Tourette syndrome, and it felt like a veil sort of coming down from in front of my eyes. It was like someone was describing my childhood in front of me. And I went up to her at the end of the lecture and said, "Look, I think I've got the syndrome." She said, "Yes, you have." And she'd seen me ticking, and she sort of picked up on, you know, this during the lecture, and so that was my diagnosis essentially. So it's never been sort of written down on my medical records, but we went on to actually write a paper together where I described the sort of sensation of what it's like to have Tourette's syndrome. Like many people with Tourette's, my tics have become much less obvious in adult life. So I used to tic a lot, and it was very disruptive in childhood. But in adult life, it's been much less. I mean, I think it's noticeable, but I think it's much less noticeable. And you can tell by the fact that I'm a professor and a consultant physician that I have functioned well in life despite this condition, whatever you want to call it. I don't think I heard the term neurodiversity until I was in my 40s, for example. I mean, when I was a child, the concept didn't really exist. I was just an odd kid. And I've turned out to be an old adult, and I'm very proud of that fact.
I would say that definitely counts as a diagnosis.
Hi folks, I'm Sam. I'm a PhD student in the Department of Geography and Planning here at the university. So whilst I was at primary school 16, 17 years ago now, I was diagnosed with dyspraxia. It was picked up when I was at primary school, when I was really struggling to learn to keep up with the work. So after various conversations between my teachers and my parents, and with it being visible to people around the school that I had challenges with coordination, particularly during like PE related, physical related activities. After that I ended up going through kind of several rounds of assessments and seeing kind of community support, and then I was eventually through the NHS diagnosed with dyspraxia.
Hi everyone, my name is Erin McCloskey. I'm a postdoc over at the Civic Health Innovation Labs just down the street. And my story is a little complicated and perhaps a little niche. I'm not from here. So I'm from the state of Minnesota in the US, and I came over to the UK in 2018 to do my PhD. Naturally, COVID followed, and I had 3 profound bereavements, including my mom and grandma, who were my parental figures. And it was during my PhD, especially after those experiences, that the cracks started to crack really wide open. And it was during that time that my primary supervisor said, I think something's going on. And so I went to the disability office down at Canterbury Christ Church, which is where I was a student. And I was told then that I couldn't access support because I was an international student. So I carried on and barely made it through my PhD, and then I found out that I was pregnant. And that's not the news you necessarily want to get the day you submit your thesis, but here we go. And it was after my son was born, close to 3 years ago, that again the cracks started to crack open even wider. And I was referred to the perinatal mental health team, where I was working with specialist midwives who support parents who have different mental health needs. And it was then that I was referred to the perinatal mental health services to be assessed for ADHD. And the cracks are still open, and I'm still learning how to adjust to what that means, especially in terms of the context of being a mom to a toddler. But I'm working through it. Particularly challenging at that age, so well done, Mama. So a relative buffet of neurodivergent conditions here. So the first question, the next question is for Sophie and Sam as our students. So how has your neurodivergence shaped your experience as a student? And the dreaded second part of a question, when you've got neurodivergence, you will forget, but I will say it now and we can say it again in a minute. Where are the challenges, but also what has helped?
It's a really good question. So if I, in relation to my experiences, if I take you back to the start of my time now in higher education, so when I was starting my undergraduate studies, and even before that as well, going back to secondary school and primary school, I really struggled with essay writing, particularly. Not generating ideas. I've always had quite a creative and wild mind in that sense, but constructing like grammatically correct sentences and kind of presenting the logical flow of my information. All the ideas were there, but they were a little bit jumbled up, to put it like that. So that was something that I really struggled with. This wasn't flagged nor included under the support plan that I had with that university that I was at the time. It was viewed, these things that I've just mentioned were viewed more to fit the profile of a dyslexic learner rather than a dyspraxic learner, where I found through my experience that the two very much overlap. I've been able to do this, but it just meant that I had to spend more and more time kind of working on it, refining, re-editing, constantly redrafting, and then to get to the point where I was happy to submit work and for it to be at an appropriate academic level in this sense. That kind of then really impacted the time, the energy, the capacity that I had to socialise and to make connections beyond the course or studying through societies, trips, events and stuff like that.
Yeah.
So that was quite challenging. But what I found really helped, and as someone that's had the privilege of being able to get an early diagnosis and be able to get the DSA funding, I was able to access study skills support. So throughout my undergraduate course, I was able to have 3 years of quite intensive study skills support, and that really helped. Being around someone that kind of understood and got my dyspraxia and what I needed help with, but particularly like finding a way to help me with the sentence structuring, with the paragraph structuring and all that, and going through it at my pace.
Yeah.
Finding a way for me, I really connected with the Peel paragraph approach and really breaking that down slowly bit by bit. And that made a massive difference. Now I write completely differently, and it's finding that way has now saved me, and having that support so much time that I was originally spending. So having access to that support made a massive difference.
Yeah, because a lot of people think that dyspraxia is just bumping into things or like physical stuff.
Yes.
I've read that it could also be around, sequencing and patterns and getting things in order, which would absolutely track for gathering your thoughts before an essay. Yeah, and just one more thing, I'm just worried because of time. I'd just add in relation to that question. So I've also faced more challenges as well with my coordination. So during my master's graduation, just for one example, rather than doffing my cap, which we were required to do when crossing the stage, I'd really overplayed that action in my head beforehand because I was worried because of my dyspraxia I was going to get it wrong. And then in real time when crossing the stage, I kind of panicked and flung the cap off my head several times. I can see the funny side of it, the lighter-hearted side of it now, but I realised at the time that onlookers who might not be aware of dyspraxia might think he's just messing around, he's attention-seeking, la-da-da-da. I'm not. So I think there is that lack of awareness, maybe general awareness and understanding about dyspraxia out there, the challenges it presents people and how it can affect you in quite subtle but profound ways. So yeah, I'll leave it at that. Yeah.
Thank you. I have really not had the typical higher education experience with like the going out and partying and things like that. That's really not my scene. I really just wanted to be able to access the education side of things. So being able to have access to all the amazing resources and be able to have amazing opportunities through fieldwork and things like that. I didn't actually start my higher education despite being an undergraduate at Liverpool. I started it at another institution which was not very accepting of the needs that I had, and I was able then to start at Liverpool in second year. So they were able to take into consideration the things that I'd done the year before, which was absolutely incredible and so accommodating. So I was able to then come here and continue, and I'm hopefully graduating this summer. And I mainly really struggle with making friends and talking to people, which maybe is not what you'd see from me right now because I'm presenting to a whole room of people. But I really struggle making connections with people without like specific social rules. And I also really struggle through that with working in groups because I've found that people tend to either be, oh yes, we'll do everything and we'll help with everything, or I'm not going to do everything, I'm going to expect other people to do it for me, and there's not really much in between. So that's one of the things I really struggle with, but hopefully that will get better and people will become more engaged as I go through my higher education journey. But the other thing I also really struggle with is like fire alarms and sensory issues. That is one of the big things for me. Fire alarms completely offset my day. So I know when each of the buildings has a fire alarm through the week. So I'm like, right, I'm not in that building between these hours, so I don't have the fire alarm. Obviously, there's fire alarms that you can't avoid because it's like a test or something has gone wrong. But that's something that I just have to think about in my day. And I think one of the things that people should consider is the amount of things that neurodivergent people also have to consider on top of the general things that you need to do to be able to get through everyday life. And because of that, I really struggle to live alone. So I still live with my parents and I commute into uni, which also makes it harder because I don't live with people that I would be able to make friends with and things like that. So I just think it's really important to consider there are lots of different things that require attention for neurodivergent people other than just life.
Yeah, and all of that takes extra energy, right?
Yes.
Yeah.
It's very exhausting.
Thank you very much. Okay, next questions for Erin and Jenny. So Jenny, would you like to go first? Do you have any advice to anyone who's starting out the journey to diagnosis?
Unfortunately, not everybody can be diagnosed by accident. So I'm very sorry to everybody who doesn't just stumble across a diagnosis in the way that I did. I think the main thing that I would say if you're kind of starting out on your diagnosis journey is I think it can be really tempting sometimes to try to get the process done as fast as possible, really. I know that there are really long waiting lists, and there are, you know, alternative providers, there are private providers that offer shorter wait times. I think a lot of the time it's really important for people to be able to kind of reflect on their decision, I suppose, to pursue a diagnosis. It is a really big decision and it can change a lot about your life. So definitely don't feel like you have to rush through that process. There are things that you can start to do in the day-to-day to accommodate yourself pre-diagnosis as well. So there's not really kind of a magical moment where, you know, you get diagnosed and then all of a sudden you can now do all of these things and everything becomes a lot easier for you. I think it can be about, you know, figuring out any sensory challenges that you might have, exploring things like assistive technology or coaching or various things that I know the university has available and that is available through the NHS. In some places, it can be a little bit of a postcode lottery. I do understand that. But I think, yeah, sometimes it is just about figuring out what you can do in the day-to-day to understand yourself a little bit more, to accommodate yourself a little bit more, and not to kind of rush into that process. It can take time, and sometimes I think it can be beneficial for it to take time.
Yeah, thank you, Jenny. Erin? You summed it up so beautifully. So I'll just add a point that perhaps people wouldn't consider, but as an immigrant, you don't come with all the documentation that you normally would have to provide for a diagnosis. So when I was being screened through the perinatal mental health team, they asked me for my school reports. How? I live here for a reason. I couldn't access those even if I wrote to my elementary school or my high school back in the States. Like, what is the likelihood that they would say, oh, here you go. They're 20 years old. Like, thank you for that information. So I think the rigidness of still receiving a diagnosis can really deter somebody. So my small, but in my case, very big tidbit would be to document, whether it's just through a journal, just taking down notes of how you feel throughout the day, noticing when your natural highs and attention are in sync and when they are lower. The other really frustrating part of receiving a diagnosis, and perhaps people have also experienced this too, is that they want a parent to fill out your forms of what you were like as a child. And I blatantly said, all of my people are dead. And they said, well, do you have any siblings? And I said, yes, but my sister is younger than me. So every time that I hit a roadblock, I had to come up with an adjustment to be diagnosed and therefore receive reasonable adjustments, which seems a little bit confusing. And so they said this is part of the process and we really need somebody to verify what you're saying, as if my word wasn't enough. So my small addition to what Jenny just said is document, document, document. Thank you. I think sometimes having a parent attend is also a big barrier for people because the parents don't always see it, or there's some kind of guilt there, or they're neurodivergent as well, and this is normal. Yeah. Thank you very much. Okay, so next, Lance, as an academic and also as a clinician as well, how do you think your neurodivergence has helped you during your career or hindered?
How do I think it's helped me? I think it's been largely neutral, to be honest. I don't think it's particularly hindered me, and I don't think it's particularly helped me. I mean, we live in a world where the most frequently occurring phenotype is, the word is geared around that. So if you vary from that, then things can be a bit more difficult. But the fact is, we all vary from so-called normal to some extent, and we're all diverse and different in our own ways. I think the key thing that I would say, which I think applies to neurodiversity particularly, but I think it is actually true of anyone, is to understand yourself and work to your own strengths, because we've all got different strengths and weaknesses.
Yeah.
We should not all be the same. I mean, and, you know, if you have a team of people who all have the same strengths and weaknesses, then you haven't got a well-functioning team, for example.
Yeah, it's also about what you said before about how, you know, you've functioned fairly well and you're considering, but it's the energy behind closed doors that people don't really see. So yes, you have got to this you know, very, very senior position, but sometimes it's how much energy that costs you in comparison to other people, I guess.
I mean, it would be in spite of neurodiversity rather than because of, I think. So I don't know. Well, I've never lived my life without it, so it's very difficult. I would be speculating, you know, to say, well, what would I have been like if I didn't have this condition? Who knows?
Maybe it's because I've been diagnosed later in life, so I've just questioned that a lot more, and the grief that goes with that of like, how could it have been different? But I'm sure a lot of nodding hands, so I'm sure you all agree. Okay, thank you. So the last question is to everybody. What do you think is the biggest strength to being neurodivergent? We'll start with Erin, I guess, and then come back along.
For me, I would say it's empathy. So part of my role as a researcher is I lead a public and patient involvement group for a study called Dynamics. And I work with really tech-heavy folks, and their strengths are not working with people. But I feel like a way I can complement the larger team is working with empathy. And it's not everybody's boat, but I'm a hugger. So it's really nice to know that people get that vibe off me and just run towards me for a hug. Mm-hmm. Personally, I love that. I know that's not everyone's thing, though.
Thank you.
So just building on what Erin was saying there, one of the biggest strengths for me, particularly coming from a dyspraxia point of view, would be empathy as well. So I think connecting and trying to, in your preferred way, most comfortable way, read other people's emotions and feelings, or find your way of connecting during positive and challenging times. And I think for me, that's something that I find I can do or feel enabled to do around my closest friends, people that get me and just accept me for who I am. But then that's a relational thing as well. It works both ways. I think also that tendency to want to like please people that you're around, and the majority of time, and try and find ways of de-escalating or avoiding unnecessary conflict. And I think as well, just coming back to that point as well, like just surrounding yourselves around like-minded people, I think is something for me over time I can see as being a real strength. And I think I'll leave it on this note: the more that we care about each other, the stronger that we can be as a collective. And I think for me that's a real strength of neurodiversity.
Yeah, absolutely. Thank you.
Yeah, I would agree with that. I think acceptance is the greatest strength. Acceptance of other people as they are, and acceptance of yourself as you are, most importantly.
Yeah.
I'd say my greatest strength is my ability to focus. I can find something and I will hyperfixate on it. Currently it is ponds, so if you have any question about ponds, please come let me know. But sometimes that is detrimental, because I will realise I have been sat at my computer for the last 5 hours. I haven't had food yet. That's something I need to do as well. Also, everything I have is colour coded. So if you need something organising, please also ask. Also, thank you.
Yeah, very, very quickly, creativity, big ideas. I think it can be a little bit trickier when it gets down to kind of fine-tuning those ideas potentially, but I think a lot of people would agree that it can a lot of the time be neurodivergent voices that are really pushing forward with creativity and with real change.
Yeah, I think acceptance and empathy is when you've struggled so much with something, you just want to help other people, and we've got a lot to offer the world if we just accept each other. That acceptance is huge, isn't it? So thank you very much, everybody. It's been really nice talking to you.